We are a specialty lab for derm only, so what we do here is all derm, and so we're really good at what we do because that's all we do.
Every individual here, from the people who are accepting the specimen to the people who are processing the slides to the doctors who are reading them, are always putting the patient first.
Our turnaround time is great. Our pathologists are brilliant and they work very, very hard. They care about patients. You can see it in their work every day.
One of the nice things about Forefront is that we're all dermatopathologists. So we did our training and then we did an extra fellowship in specifically skin pathology.
Right now we have 7 dermatopathologists, and all of them have many, many years experience.
I take cases to my fellow dermatopathologists. I can take difficult cases or unusual cases right next door to another dermatopathologist. So there's more than one physician oftentimes can collaborate on the care.
When you have the best people with the most experience and educational background, you'll probably get the best results.
Our facility is really state-of-the-art.
We check everything, and we check it twice, and we check it 3 times.
We've implemented technology to make sure that it's all on a barcoded system, to make sure that no one can ever accidentally transpose a number, resulting in the wrong patient getting the wrong slide. These are safety measures that not every lab in the country has. In fact, I don't think that many of them have.
As soon as the pathology is done, that means the patients can get the results faster. So, I mean, that's our whole purpose, is to get results to the patients. So when I can enter cases a little faster, when I can type a little faster, when I can sign out and finalize things a little faster, that makes me feel good about what I'm doing here. Sometimes I'll even time myself to see how many cases I'm getting done per minute.
Pathology is interesting. You know, going through medical school, we see patients. Going through dermatology residency, I saw patients. In pathology, we don't have that luxury. And so there can sometimes feel like there's a separation for both the pathologist and the patient because we don't actually get to meet each other. But I think as pathologists, it's important to remember that each of these biopsies represents a patient and a person. And all the concerns that patients and people bring with them.
I personally try to put myself in their shoes. Going to the doctor can be very scary. Having things cut off of you can be very scary. And I would just want to know that the best care is happening behind the scenes.
Being able to finish the day knowing that I made a difference to help another person. I try to think of people, whether in the clinic or here in the laboratory, as being members of my own family.
Sometimes when you're just looking at a glass slide, people may not realize or think about a patient, but I literally, in my mind, I think this is my mom, this is my mom, this is my mom. And how would I look at this if this was my mom's biopsy? Because then that helps me to make sure I don't miss anything.
As a group, we are caring. I think we try to be thoughtful. We try to consider the needs of our patients and make sure we get accurate diagnoses without waste, without, as best as we can, running up high bills and things that are important to our patients.